This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, can you guys see the main screen? We good?
You're good.
Awesome. Hey, everyone. So welcome. I know there's a lot that you could be doing tonight, but we are so thankful that you're here. My name is Nick Elwert. I am one of the faculty members in our APD here at the University of Kentucky. We have a couple of people from our program that will be coming in and out tonight. So we have Belle McDermott. She is one of our aspiring peds PM&R folks, and then we also have a couple of our chief residents, Dr. Batra and Dr. Larson Halleck, and then our program director, Dr. Key, is going to try to make it on as well. She is currently reading to her son as he starts second grade tomorrow. So I'm also hopeful that Zach does not have to interrupt me, as I am 2 for 2 with having to be interrupted for going over the 20 minutes. So here is our program. This is a pretty recent picture of us at a recent wedding of one of our residents. So what are we going to talk about tonight? We're going to go over some of the basics about the program, talk about the resident schedule, our wellness initiatives, didactics, and then our mentorship programs. We're also going to talk about the 2 main hospitals where you do rotations. And then if you're not familiar with Lexington, we're going to talk about Lexington as well. So first off, our program leadership. So our program and our department is led by Dr. Susan McDowell. She is our department chair, and then our department vice chair is Dr. Sarah Salas. The residency program is led by Dr. Key, and then I am our associate program director and our resident research advisor. And then really who makes everything work is our program coordinator, Leslie. She is amazing at what she does and is such a vital component of what we do here at UK. From a residency leadership standpoint, these are our 3 chief residents. So we have a new chief resident this year. We added a wellness chief. We are very passionate about resident and department wellness. And so much so that we wanted to have a chief that was specifically dedicated to that. So here are our chiefs this year. Dr. Larson Halleck is our academic chief. So he takes care of all didactics and didactic schedules. Dr. Adriana Natali is our wellness chief. And then Dr. Maddie Batra is our administrative chief resident, taking care of call schedules, holiday schedules, etc. So a little bit about our residency program. So we are a 4-year categorical program. We have 6 residents per year. We just got a complement increase from ACGME. So we are stoked to be able to open up that extra spot and to have 6 residents. A lot of work went into that, but we are so excited. What are some of the benefits of our program now? Right, there's only so much you can put on a page, but these are some of the things that I wanted to make sure that we highlighted. So when you look at each academic year, our PGY1s receive Bradham and DeLisa textbooks so that they have those when they do their PM&R month, but then also have them when they're on their off-service rotations. As a PGY2, you get Cucurullo board review. You also get 2 texts that are related to PM&R. They do not necessarily have a cost max. So if you happen to be interested in interventional spine and there are some interventional spine texts that you would like to purchase, those would be two techs that you can get. If you happen to be more MSK or neuro rehab, you can also get those techs as well. You also get a laptop that you can use throughout the year. And then you also get multiple other techs. And I kind of just grouped this together. You get an oral board prep book, a brain injury textbook. So there is no lack of resources on top of our resident library that you have to get as much knowledge as you can from a tech standpoint during your time here. As a PGY3 and as a PGY4, it comes more with monetary stipends. So as a PGY3, you get a $600 education stipend. This can be used for whatever you see fits to help with your educational endeavors. And so, for example, some folks will use this for PM&R recap or for ultrasound guidance. When I was a resident, this was quite a few years back, but when I was a resident, I used my funds on PM&R recap and got like a 2-year subscription so that I could use it for boards. And then as a PGY4, you get a $1,400 lump educational stipend. This is typically used to help offset the cost of boards / a board review course if you choose to take one. You also get 2 paid conferences as a resident. So we send all of our PGY3 residents to AAP and all of our PGY4 residents to AA PM&R. As a 3 and a 4, you do submit research to AAP and AA PM&R, but irrespective if the research gets accepted or not, you are still sponsored to go, and that is everything: travel, lodging, food, as a 3 and a 4. We also have the addition of resident research travel awards. So each academic year, we have the opportunity to award 4 travel awards. So these are, again, all expenses paid stipends or awards that you can use to present your research. They are done on a quarterly basis, and is another awesome opportunity to not only showcase the program and your work, but to also build those relationships and start networking. You also get personalized scrubs and white coats every year, and then you get a food stipend and free parking. So let's kind of get into the clinical curriculum, and we're gonna, as we're a categorical program, we're gonna start in our PGY 1 year. So our PGY 1 year is really formatted like a transitional year. So it's a mix of medicine and surgery. So our residents go through 4 rotations. A rotation is just a month. So 4 rotations in internal medicine. And then each one of these has 1 month of neurology, inpatient orthopedic surgery, which is trauma, typically outpatient orthopedic surgery, outpatient pediatrics, neurosurgery. This is new to our residency, but we wanted to include sports and pain medicine because we know that that is a very highly desired field. So we added that exposure to our PGY1 experience. You also spend some time on trauma surgery and our UK PM&R clinic. I really would put any of our interns really toe to toe with any intern during the year after the year completes, just because our year is it's a difficult year, but you come out so prepared to handle any type of rehab emergency and be able to manage folks from the surgical perspective and from the medicine perspective. Taking a look at our PGY 2 year, so you have 2 to 3 months of stroke and then 2 to 3 months of brain. So this is spent with predominantly myself, Dr. Key, and Dr. Porter, who's one of our brain injury attendings. You get elective time during your PGY 2 year, and we'll talk about what you can use that for. You also go down to clinic for 3 to 4 months. So this is split between our MSK providers, our neuro providers, and then also our electrodiagnostic physician. So you're getting a little bit of EMG experience as well. And then you also spend time not only at the VA in our musculoskeletal and polytrauma clinics, but you also get a hybrid rotation that is an inpatient and outpatient Cardinal Hill rotation for amputee medicine. I'm going to explain what Cardinal Hill is kind of later on in the presentation, but Cardinal Hill Rehab Hospital is our freestanding rehab hospital, which is where we have our inpatient and outpatient experiences. As we transition into our PGY 3-year, this is where you get your spinal cord injury experience and your general rehab, mostly orthopedic and just general rehab needs. Both of those rotations, you're spending about 2 to 3 months. For our VA, this is where you're getting your VA amputee experience and consults. You also get your pediatric rehab time here. This is predominantly with our Shriners rehab colleagues. And then we have brought on a PEDS rehab physiatrist that is going to be formalizing our PEDS inpatient experience. Elective time. And then you also get to be a part of this team called the teaching utility team. So this is essentially like a junior attendingship where you are kind of running the show with the attending from the inpatient perspective. And so you get the experience of what it's like to review pre-admission screens and all of the other attending stuff that comes with being an inpatient provider. You get to experience that a little bit more on the teaching utility team. And then our Cardinal Hill Clinic for 2 months. As a PGY4, this is where you get a lot of your EMG experience. So you're getting it your 2nd year, your 3rd year, and your 4th year. You also spend a month of inpatient on the teaching utility team, and then also go back to the amputee service. You also have elective time, and then you're doing consults at our acute care hospitals. Well, we talked about electives. So you get elective time, both your 2nd, your 3rd, and your 4th year. And these are some of the things that you can do your elective time in. So you can go spend some time with our sports medicine colleagues, interventional pain colleagues. If you wanted to do a combo neuro rehab experience, you could. Or if you kind of wanted to do something a little bit more unique and do just an ultrasound elective or just a spasticity elective. We had a resident also do like an administrative and leadership experience. So this is where this particular person spent time over at UK Chandler, which is our big acute care hospital, with some of their hospital leadership, and then also spent time here at Cardinal Hill, just getting the idea of the administrative side of medicine. If you want to do hospice and palliative care electives, if you just want a research elective, really, you can do whatever you would like, and you can structure it to how you like and how you see your career going. All electives are approved through our education committee, but the flexibility that you have with these are pretty significant. Now, initially, when you're doing your electives, if you don't have a QI project, half of the time of the elective is spent on research and developing your QI, where you'll work with me as your resident research advisor, formulating your project and your plan. But there is a lot of flexibility with your electives. As I mentioned to you, resident wellness is huge here. It's one of our main pillars of our program. And as I mentioned to you, as such, Dr. Natali is our resident wellness chief. And here's some pictures that we have. These are more recent photos over the past couple of years. This is all of us, some of us drenched at Disneyland at AAP. We have this picture here, which is at Belle's bridal shower. I think this was a Christmas meal with some of the PM&R girls that Dr. Key heads up, and they do some gift exchanges and ornament exchanges during the holidays. I think that's at one of these dinners. And then this is welcoming some of our new interns from this past year. Here are some more pictures. So here you can see this is Dr. Roos here. She was our faculty wellness chief. She moved back home to South Carolina. And so Dr. Hogenkamp, who's one of our other providers, is going to be our wellness champion. So we're excited to see if she brings some yoga or what other wellness initiatives she brings. Here we are doing some education in the community about botulinum toxin. If you know anything about Kentucky, you probably know that there's some horses that run here. So this is at Keeneland. And then here are some of the residents at AAP, and this is some resident faculty and staff at AAP as well. Talking about our didactics. So our didactics occur every Tuesday and Friday morning from 7 a.m. to 9 a.m. Now, during this time, you are protected from all clinical responsibilities. So your pagers, all of the pages either go to Dr. Key or myself. We cover different days. And that way you don't have to feel like you have to go in and out of the room answering pages while you're also trying to learn whatever is being presented. So you are protected from all clinical responsibilities. And some of the features of our didactics include a chief rounds, which is essentially a resident-led lecture series where PGY3s do a formal presentation. This is also where we do our oral board prep. So there's some really awesome things that come with chief rounds. We also have a dedicated SAE review course before the exam in January. So this is Dr. Key's pride and joy, where she creates the schedule based on based on previous performances and being able to focus on some of the areas where you can increase. And it is predominantly both faculty and resident led. And then we have grand rounds. On average, we're about a 16-month rotating schedule. We have some courses that are staples. Our I Am a Physiatrist course, which is an intro to PM&R, our anatomy course, are staples. And then we also have a career development and SAE course that I just mentioned that are staples of our curriculum. Our career development course is after our SAE exam, and this is meant to help learn billing and coding in medicine, all types of aspects for career development. So I think we had some lectures on networking last year. How to write a CV is always a staple in that lecture. One question that always gets brought up is mentoring. So what kind of mentoring opportunities or what type of mentoring infrastructure is at UK? So we actually have 3 different layers of mentorship. So you have your own research mentor. So whatever project you might be working on, whether that's a case report, a case study, a retrospective study, a prospective study, you will have your faculty research mentor there. And then on the side, I am your resident research advisor. So really 2 layers of research mentorship. You also have a peer mentor, so you are peered with a peer resident that is a couple of years ahead of you so that you can glean some wisdom from them. And then we also have the formal residency mentorship where you as a resident are paired with a faculty member. You are paired with Dr. Key first. And then if your interests happen to be in spinal cord medicine and you want to switch your mentor to our spinal cord injury docs, then you can formally transition your mentorship during your PGY 2-year to continue throughout residency. So there are lots of mentorship layers here because Dr. Key and I both agree that mentorship is vital for success. This is a illustration of some of the main hospitals that we do our rotations at. So here in the bottom right-hand corner is Cardinal Hill, which is our freestanding rehab hospital. To the left, left corner here is Chandler Hospital, which is our acute care rehab. It's our acute hospital. Here's the VA, and then this is Shriners. So real briefly talking about Chandler Hospital. So it is a 945-bed acute care hospital. It's a level 1 trauma center. It's a level 1 pediatric trauma center, comprehensive stroke center, and a National Cancer Institute. Our catch base for patients is very large. We get a lot of Eastern Kentucky and our surrounding areas. And so there we see a lot of patients, and unfortunately, they are pretty sick. Taking a look at Cardinal Hill, it is a 232 bed freestanding rehab hospital with outpatient therapy clinic and 2 aquatic pools with quite a bit of available technology. taking a look at Lexington, if you're not familiar with it. So population is about just over 300,000. It is quote unquote known as the horse capital of the world. And you always love the random facts about cities. It's the 8th best city to live in America and the 3rd safest city to live in the country. I will tell you, if you it is an awesome, if you want more of a suburban feel and you want to be kind of out in the country, you can do that. If you want the city life, you can do that as well. I want to make sure I take a minute to talk about Wildcat Wednesday. So this is an interactive Zoom series that we started when COVID really changed the recruitment, everything about recruitment. So starting next Wednesday, we will start at 6 p.m. Will be our first one to talk about the program. And then each week, we're going to talk about different aspects of the program, different things that we do here. And we're going to go kind of in depth about the inpatient, outpatient experience. And so I'm going to put the sign up in the chat. We'll send you out the Zoom link when closer to the date, but we would love to see you there to learn more about our program. Are there any questions with the, I think, 1 minute that I have?
I think everyone's just saving it for Wildcat Wednesdays.
Hey, I'm successful. My goal was completed. You didn't have to cut me off. Guys, I'll put my email in the link. I see a couple of familiar faces as well from the program. If they feel that they want to drop their contact information, we will into the chat. But please, we're an open book here. We'd love to hear from you. We'd love to tell you more about UK.
Thank you, Dr. Nick. Thank you guys very much for being here.